This is Karthik Yadagiri, your physical therapy doctor from the American Institute of Physical Therapy, an affiliate of IPTA. The reason why I'm here is to give you a demonstration of some of the manual therapy techniques of the thoracic spine. As you all have asked, and if some of you might have attended my courses, you must have learned that thoracic spine, based on the principle of regional interdependence, is a very powerful area. Anybody who has pain in his neck or in his shoulder, the reason why they have the pain could be offset and can temporarily change if you do a thoracic manipulation. The research evidence also suggests that if somebody has a knee pain or a back pain, could have an impact by doing a thoracic spine manipulation. I'm going to demonstrate to you today 2 techniques that can create a great impact. So one of the technique is a flexion technique, where the patient will be laying on his back and I'll be performing the technique. As you can see on the spine, I'm going to put my hand on the spinous processes and I'm going to turn him and do the technique, which I'll demonstrate to you with a model. Come on in. So as you can see on the model, the patient will be laying on the table or the couch or the plinth that you have. His both knees should be bent when you're doing this technique. And the most important thing is you need to be able to maintain flexion in the spine and a little bit of rotation when you do the technique. Most importantly, remember, I hope you already learned the indications and contraindications. You will not do this technique on a person who's osteoporotic or who has an acute fracture, just recent surgery. You do this on somebody who's hypomobile, where the movement is very difficult, but they also pain the neck or shoulder or knee. You can do this technique. It's very safe. As I mentioned earlier, thoracic spine is a very safe area, unless if there's any serious problems, if it's osteoporotic or menopausal. But other than that, it's a very good area to manipulate. I would ask the patient to bend both their knees to be comfortable. Then I would ask them to cross their arms across their chest. It could be in any direction. Doesn't matter which hand is on top. It's the comfort of the patient. If it's a female patient, I'd ask them to put a towel roll so it's not uncomfortable and the shoulders are not being pushed. So the goal is to keep those elbows together and turn the patient towards your side. So when he turns, you instruct the patient to stay there and you put your hand flat on the area we want to mobilize. You want to see if there's a hump in that area. Typically, that's the area to manipulate. So if there's any pain or stiffness, you palpate and then put a flat hand where you put the spinous process right in that area. So you ask the patient to roll and lay on their back again, where the weight of the spine is on your hand. Now, you keep those elbows closed and tuck them under your armpit so you can generate some flexion. So that itself can cause a cracking or popping of the spine. So maintain flexion, lift their head slowly, nicely towards you. So that maintains a little bit of side bend and rotation. So you go into the patient gently and put your weight and breathe in. On exhalation, breathe out, gentle push, and there's a pop. That's it. So the next technique which I'm going to teach you is in sitting, where the patient is sitting with their feet on that side and their back is facing you. You ask the patient to scoot all the way back to the edge of the table so they are close to you. So you use a towel or anything that's hard but you can put on the patient of the area you're going to manipulate. You're going to put it on them and the body weight is going to be on your sternum. You ask them to cross their arms again across their chest, keeping those elbows tucked down. So this is the key part to this manipulation. This is what maintains the flexion, and you pull down and up towards you without letting go of the elbows. You have to maintain the push down, so that maintains thoracic flexion, and then you pull up, maintaining a J stroke. So that is the end of the thoracic manipulation. You have seen this video in 2 parts. So if you have any questions, please subscribe to my channel, American Institute of Physical Therapy. For more videos, please subscribe. And thank you and have a great day.